So I'm going to talk a little bit now about a short luteal phase and how that can be a barrier to conception when you're trying to conceive naturally. So the luteal phase is basically starts, it's the latter half of your cycle. So after you've ovulated, which is the main event in your menstrual cycle, then even if your egg has fertilised, if your luteal phase is too short, then it might not be long enough for the fertilised egg to actually start to embed into the endometrium. So when I say too short a luteal phase, I think in Western medicine they see anything as shorter than sort of 9 or 10 days to be a problem. In Chinese medicine, we would sort of ideally really like to see a luteal phase of around 14 days. So that you should start your period 14 days after you ovulate. Sometimes it might be slightly longer than that, that's fine, but if it's certainly if it's shorter than 12 days, then that might be a contributing factor as to why you're not conceiving. So the good news is that acupuncture is quite good at moving your ovulation. So in this scenario, normally patients might need to come for a total of about 3 months in my experience. That doesn't mean you're having to come for treatment every week, so you might be coming more often through, like for the first cycle we would treat you once a week, every week for the 4 weeks if you're on a 28-day cycle. Then then after that we would start to focus more on the beginning part of your cycle to try and encourage ovulation earlier. So there are also some things which can affect your luteal phase, such as stress, which if it's impacting upon your lack of sleep, that can have an impact. But I'm going to talk a little bit about other factors which affect fertility later. But you can really do quite a lot with your diet as well. So I think there's been some evidence that vitamin C can be beneficial to lengthen a luteal phase, and there are some supplements that you can take as well. So all of this would be discussed in your consultation.